Good afternoon, everybody. Here it is, chiropractic guru, Dr. Nelson Vetanze. And we have Mr. Benson, who drove in from Nebraska today, and he'll tell you about his symptoms. The reason I wanted to make a video coming right back after the last one is because I've noticed all the videos I have made so far with all you wonderful viewers that they last like 45 minutes, 45 minutes, and I don't want the chiropractors to think that you spend that much time on every patient. It's because I'm trying to explain to you and teach and treat at the same time, and I don't want to miss telling you anything. Plus, I get a little philosophical sometime when other chiropractors, doctors, or situations become evident, and I need to say stuff about it, so I don't want to expound. I just want to tell you today, this is a form that's given to every patient when they come in. This is a description of gravitational pattern alignment, is exactly what to expect and what I will do when they come in, working from the feet to the top of the head, and explains it concisely so the patient knows exactly why I'm working on their feet to fix their neck. This is available for any of you who are part of the program for videos and or have the manual or in the process of getting certified, which I would recommend all of you do. Okay, now what I want to do with Mr. Benson is I just got a phone call here a couple days ago, and he told me what the situation was. So, Mr. Benson, basically, I'd like to know about your condition, what you're suffering with, what they want to do for it, how long you've had it, and please tell everybody.
I've been fighting a pinched nerve in my neck since January. It's going on 3.5, 4 months. The pain will not go away. It's driving me right up the wall. I've been to my general practitioner. I've been to an orthopedic surgeon. Now I've had MRIs. I've had the injections in the neck. I'm at the point now where the neurosurgeon who I met with last week wants to do the fusion in my neck. I just can't get any relief. Haven't had any relief in 3-4 months. I'm tired of the pill route. They've fed me every kind of pill they can think of to get through. I don't like it. I don't want them. There's got to be a better way. My daughter Brittany's been telling me I have to get out here, come to the doctor. I said, I'm going to do it. I want to get out here. I can see if he can help me. And I'm certainly hoping he can. This is the first time I've ever been to him, so I'm as anxious as anybody else.
Okay, thank you, Mr. Benson. You drove 7 hours to get here?
Yes, sir.
So we're going to work on Mr. Benson today, and of course, if I help him, you'll see the video. And if I won't, it's irrelevant. You won't ever see the video. All right. Okay, now, Mr. Benson, they've worked on your neck. They've taken MRIs, whatever, give you injections over and over. Nothing seems to work.
No.
So the specialists right now are chasing symptoms. They're chasing the pain. Right. So when the Mr. Benson comes in, I have him sit, and the first thing I do, okay, first of all, I watch him walk. Next thing I do is put my one palpating finger on the left sternoclavicular joint and the other one on the right. Jerry, it's up here in his neck. Can you see that on the video? We're about 2 inches high, and that's real tender there, isn't it?
Yeah, it's still soft.
Okay, now let's slide off into the first rib. Okay? Hurts like hell, doesn't it?
Yeah, the left side does.
Left side, okay? This is his pain on the left side. All right. So he has a 8.5, 2 inch elevation of the left sternoclavicular joint. He has a very tender, inflamed first rib and anterior and out of alignment, okay? Pinching on the thoracic outlet area. Okay, second rib, posterior back here, sore, but really not prevalent, not sticking up and not bony protuberance, okay? Turn your head left. Pain?
As you're getting there, I don't go any further.
That's okay.
Oh.
Pain on the left side?
Yes, sir.
All right, now let's turn here. Not so bad?
No, I'm fine.
He's fine, all right? Now I'm gonna do this. Pain?
It's not too bad.
Does that aggravate the pain?
Yeah, it does. A little bit.
Okay, so when I'm gonna do the cervical compression test, I'm gonna push down just a little bit.
Okay.
No serious aggravation.
No.
Okay, in a true herniated disc that you're having a bulging and you have the pressure of a nucleus into a nerve, you do the cervical compression test and it's positive. Okay, his isn't greatly positive. Range of motion is significant in that he goes to the left and he feels somewhat increase in symptoms. Now, Mr. Benson has also had chronic low back problems.
Sciatica has been an issue.
Sciatica has been an issue. Is that a clue? Very much so. So, in what you've learned on other videos, and if you don't know this, go get the videos, go to Chiro Guru, get the manual, learn it if you want to be successful and immensely busy. Lean to the left and put this under your right buttock. Go ahead. I'm putting a wedge under his right buttock because I believe he has an anterior right pelvis. The wedge causes the pelvis to be elevated and go posterior. So let's go back now to the second rib. Any change when I touch that?
A little better.
A little better.
Yeah.
How about here?
Yeah, I don't feel like it was bad. Better. That's
It's better.
Yeah.
Significantly better?
Yeah, it is better.
What a surprise. As a test, I put a 2-inch wedge under the right pelvis. Changes the rib cage, causes the head to shift, and now the sternoclavicular joint, Jerry, if you can get this, it seems a lot, it's not near as tender, is it?
Oh.
Are you pretty encouraged that I can, with a wedge?
That's amazing.
It's amazing. All right? So now we only have maybe a ½ an inch elevation of the left sternoclavicular joint. What kind of orthopedic test? Whose name is it after? There's no name. It's just a test you do to try to find out where the source of the problem comes from rather than treating the area where he has pain. Don't be a pain chaser, don't be a symptom chaser. So, sir, we're going to start your treatment, okay? Face down for me. You're right here on these cushions. All right. So I was saying, I'm going to go through it right now like would do a normal patient and not explain everything so I can let you know how long it takes. It's not always 45 minutes. You actually can make money doing this in your practice. Okay, Mr. Benson, your right foot is about 1.5 inches shorter than your left. Okay, and both legs straight and legs bent. Bend your knees for me a little here. Left Achilles tendon loose. Right Achilles tendon like a rock. Tender?
Yeah, so.
Tender right Achilles tendon. Not so tender left Achilles tendon. Plantar flexion. Okay, loose here. Completely jammed here. Okay, so let's fix that first. Bend both knees. You got more flexion in the right knee. What are you getting, cramped?
That was his back gets tight right there.
Where's your back tight when I do that? Right there in lower right?
Yep.
All right. So we got more flexion on the right, less flexion on the left, okay? I won't force that, I'm sorry.
That's all right.
All right. I'm going to put a wedge. I think you have an anterior pelvis here. I put a wedge here. I go back and flex your knees again.
Gone.
Gone?
Gone.
In other words, the cramping bad pain you just had 30 seconds ago is gone. Okay, it's crazy, he said. By putting the anterior pelvis posterior, I rotated the pelvis, took pressure off of L5. So my next thing, okay, you got a high ischium, 1.5 inches. Do what the body tells you to do. Bring it down. Bring it down. One more time. Bring it down. Okay. Any tenderness here?
No.
L5, spinous process, no. L4?
Fine.
L3?
I'm fine.
Transverse process, pain?
No.
Transverse process, pain.
No.
So his pelvis was out of alignment, foot was out of alignment, and causing all this stress in his low back, causing a curvature change all the way up to the neck. All right, bend both knees. Wow. What do you think?
Feel good.
Feels good.
Crazy.
Crazy. But he's from Nebraska. You can't BS those people from Nebraska, man. Like Missouri, it is what it is. Am I right, sir?
I don't believe that.
He don't believe that. All right, good. Now let's palpate the spine all the way up. No, good, healthy, young, strong man. Okay, atlas out right there. You get headaches?
Well, I get headaches, yes.
Get headaches a lot?
Quite a bit.
Quite a bit of headaches. First cervical out. How can a first cervical not be out if the leg's out of alignment? You got a short leg, you got a foot out of alignment, pelvis shifted, sacrum communicates with the occiput's out of alignment. Bingo. Before I do anything more here, okay, on your back, sir. Okay, bend the right knee. Okay, right hip, 40 degrees. I can accept that for what, 40 years old?
I'm a little older than that.
All right, good enough.
62.
All right, you're just a baby, 62. I ain't gonna tell nobody. There's maybe some women watching. I don't want them to,
That's all right.
I don't want them to know how old you are. All right, now, with my Lloyd table, I don't have to bend down all the time. And with my dice adjusting glove, I don't hurt my hand all the time. So now, come over here. Let's palpate the right mastoid. Mastoid bone right, mastoid bone left. Do you feel where my fingers are? Mm-hmm. You're about 40 degrees out of alignment.
Good grief.
Okay, the occiput communicates with the sacrum. When you breathe, sacrum and occiput communicate together to help you move cerebrospinal fluid. All right, so you're 40 degrees off of here, and you're,
I'm a mess.
well, it can be considered that. And so we have an anterior pelvis on the right and a posterior pelvis on the left. Since you have a posterior pelvis on the left, I'm going to put a wedge under the posterior pelvis to bring it anterior. When I do that, I come over here, and now I have these mastoid bones are perfectly even. So passive technique, put a wedge under, when there's supine, you put a wedge under the posterior pelvis. It then helps you, it passively resets the occiput. So now when I come into the occiput, turn your head left, please. And I put it just a little bit, I just tap it. Goes right in. Because I made 90% of the adjustment by putting the wedge in. I'm helping the occiput shift by itself. Turn your head left, okay? One more time, sir. Come on, come on, come on, come on. Thank you. And then the atlas is real easy to take care of, all right? So we take the wedge out.
Wow.
Oh, what'd you say?
Felt good. Wow.
He has to talk to the microphone. So he's not getting paid for this, by the way. Okay. All right, now let's do it. Mastoid bones, with no wedge or no nothing, you're perfectly even, okay? Okay. And we already checked your hips, they're normal, okay? On 3, sir, I want you to sit up. 1, 2, 3. Thank you very much. All right, now, please sit and face that way again. Face the camera and sit right in the middle, crack in the crack.
Okay.
All right. All right, now, let's check the sternoclavicular joint. What do we got? 1/4 inch? Okay, it was here before, wasn't it? 1.5 inches, 2 inches. Perfect. Let's go to the first rib. Anything?
That's all right. I'm all right. It helped. Better. You couldn't do that before.
How much better is it than the first time?
Quite a bit.
Okay, let's go to the second rib area. Anything?
Much better.
Much better, okay? So now we're going to get, it's much better. So he's probably 80 to 90% fixed right now, and all I did was his pelvis. So let's get the second rib, tap it. First rib, tap it, okay? Better?
Yeah.
Anything?
Feels good. Feels better.
Okay, hands behind your neck, lock your fingers. Elbows together.
Oh, wow.
Arms down.
Wow.
Stand up, sir. Tell the camera how you feel.
Wow. Oh, that feels so much better. I can't believe that. Wow. Crazy. It is better. I do feel better.
How's your arm pain?
My arm's better. I've got a little in that here, but nothing back there where it used to be. That back's much better.
It's one treatment.
Oh my golly. Oh, yeah. Much better. I'm impressed.
God bless you, sir.
Thank you.
All right, give me a hug. All right, good.
Wow.
That took 15 minutes. You got a new patient. Do I need to do reflexes, deep tendon reflex, sensory innervation, blah, 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 blah. You can do all those tests. You can do MRIs. You can do CAT scans. Radiologists, neurologists, orthopedic surgeons, neurosurgeons. God bless everybody. It's more complicated than treating the area that has pain or the area that has symptoms. Figure out how everything works. Whether you're getting a new hip, get the pelvis fixed. Because you can't put a good hip in a bad rotated pelvis, and it's going to wear the hip out. Shoulder surgery, why don't you get the shoulder girdle fixed? Neck, herniated discs, they communicate with first and second rib and shoulder girdle. Fix everything out, fix the alignment. All you got to do is move this 2 or 3 millimeters, and the pressure is off the nerve root. Okay? He probably moved a lot more. Now, this is only one treatment. We're going to see him again tomorrow, right?
Yep.
Okay? But this is his first visit to Dr. Vetanze's. Please give me an assessment. Tell these people right here.
I'm totally stunned. I feel much better than I did.
This is how chiropractic care is supposed to work, sir.
It feels so much better.
God bless you. Thank you, Jerry.
I can't believe I moved my neck like this.
That's crazy, Dad. He's had no mobility for 4
Oh, I
months.
can't do anything.
Welcome to the family, man.
Wow, I appreciate it.
It only took me a year to get her in.